Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And in this case, we're talking about the West Cancer Foundation. We're honored to be joined by Leighanne Soden, the Executive Director. How are you doing?
I'm doing great, Jeremy. Thank you so much for this opportunity.
Absolutely. So we have a lot of good news to talk about, including some grants and the fight against cancer. But let's dive in with a little bit of history and context. So give us some history for the West Cancer Foundation.
Sure. In late 2019, a group of business leaders, community leaders, faith-based leaders came to us and said, we need a foundation for the community that is helping with cancer patients. And they asked me if I would help them build it. And I said, of course I will. So that happened in early 2020. And we actually managed to raise money and start some programs during COVID. But in 2022, we really went full out with all of our programs and events and had a successful year because of my incredibly great board of directors. But we're started to, research is very important, but it's the programs, all the free programs that we offer that are so beneficial to the community, and we're trying to grow that.
Talk about the outreach and the expansion on this, because it is open to everyone in terms of kind of, the fight against cancer. So it's not positioned to one, it's positioned to all as a support opportunity. So talk about that side.
Sure. Our biggest program they have now that's growing the fastest is our transportation program. We have quadrupled from this time last year, and we're very happy with that because it's free transportation for anyone who needs it to any oncology related appointment. This program is growing by the day. We anticipate by the end of the year we will have invested $250,000 in this program. That's how quickly it's growing. And we will take patients free of charge to any provider, any location in the city, if they need some oncology help. We obviously focus on patients in active treatment, especially radiation. You just can't miss a radiation treatment. If you miss even one, research shows that affects the patient's outcome. So we do everything we can to make sure the patient's getting there. They don't have to worry about transportation, one less thing, but we'll provide it for any type of service that we provide.
Touch on why that's so important for the Mid-South. We hear all the time transportation is a barrier. And just like you mentioned, you can't miss your appointment. And so talk about why that's so important to knock down that transportation barrier for the individuals here in the Mid-South.
Sure. It's huge. With our demographics in the city of Memphis, so many people, young moms who maybe need to get a mammogram or need to go in for a checkup. They're like, well, do I go to that or do I feed my kids? Well, we can take that off of you because if you don't have transportation safe and reliable, we're going to provide that free for anyone who needs it. And transportation overall, the country in healthcare is the biggest number one barrier to healthcare. And specifically with cancer, like we mentioned, radiation and certainly infusions, if that's once a week or twice a month, can't miss those appointments. And we want to ensure that transportation helps them get there.
So talk about education. We'll talk a lot about research here in a second, but education, free screenings, there's a lot that goes into that side as well.
Absolutely. Our second largest program is our breast screening program for the underserved. Memphis is still in the top 10 of the worst large cities in the country with women of color and mortalities related to breast cancer. And that is not acceptable to us, to my board of directors, to anyone. Free mammograms, we will provide that for anyone who needs it. If they're underserved, underinsured, can't afford their copayment, we're going to help that lady get her mammogram because we have to get out of that top 10. That's not a list you want to be on. And that's our goal. Then we want to get out of the top 20 and on and on. But, that requires a lot of funding, and we have very generous donors. But the mammogram is absolutely free to the lady. She doesn't have to worry about anything. We'll get her there with transportation if she needs it. And, one thing that, very few cancers are detected, which is a great thing, and that's a national average. But you cannot put a dollar amount on the relief that woman gets when she goes in and maybe has missed a couple of years because of COVID or didn't have access to this free program, for them to come and say, you're good, come back and see us in a year. You can't put a value on that and that peace of mind. I know I get that peace of mind after my mammogram. So it's so important to this community, and we're got to get those numbers down, got to get out of the top 10.
One of the other cool things that I love and appreciate in terms of what you do is the wigs and the garments. And so you look at every aspect in terms of being able to help with confidence and hope and opportunity. So talk about wigs and garments.
Sure. A wig, to most of us, our friends and family, that's not a big deal. If we need one, we have the means to get one of pretty good quality. But if you don't have the money, you don't even have the money to make your co-pays. Last thing on your mind is a wig, but that is the most emotional part. And someone will tell you it is the worst part of going through any type of cancer treatment. So we provide wigs. We actually have moved into new space that we love, and we're going to have a ladies' wig boutique in our space. Ladies can make an appointment, come in, go into a private room with mirrors and all the wigs and try on as many as she likes, bring someone with her to help her, and she can take home a wig absolutely free of charge. And we're working to get a very diverse inventory of wigs for ladies. And that's a very important thing in a woman's life.
Goes into taking a holistic approach. So, I mean, that's why I think it's important to highlight all the things that you do to really pour in. So go ahead and talk about the garments as well.
Sure. We provide lymphedema garments, and that is something that no other organization in this country we know of has an organized program that gives women and men free lymphedema garments. They can be wraps, bandages, any type of glove needed for lymphedema. Lymphedema is a horrible, horrible side effect of many cancers. And if you can't, they're expensive, the garments are. And if your insurance doesn't pay, we will help you get that garment you need absolutely free of charge to you. The same thing with post-mastectomy products that women need. We'll help with the undergarments, the prosthesis, help them be fitted, because that is part of being a whole woman. When after you have a mastectomy, you want to feel good about yourself. And we provide that, again, completely free of charge. And we're the only organization providing both of those services.
Love it. Let's dive into the research and the grant. As I mentioned in the beginning, is partnered with the University of Tennessee Health Science Center. And so talk about the grant and the good news.
Sure. We have had an opportunity to get to know Chancellor Peter Buckley, the new chancellor. I'll say he's new. He's been here about over a year at UT Health Science Center, and we are growing our partnership with UT. We have donated and given grants, 1.2 million total since we started to fund some of the oncology fellows. This program brings the very best and brightest to Memphis. So we want to get them here, we want to fund them, and then we want to keep them here. And that is something that our goal is with the Fellows Program. The grant we just provided for about $90,000 was to fund one of the gynecological oncology fellows who works with the very best oncology surgeons here in Memphis and trains with research in the operating room, seeing patients, a full training. We really believe in that program, and Chancellor Buckley, like us, he wants collaboration in this community. We want to be able to work with everyone that will work with us. And we have a shared mission, a shared vision. We work very closely with the University of Memphis and their School of Public Health. President Hargrave is very involved with us, and we're working on some cool projects that you might hear about a little bit later. But those are the kind of collaborations with that type of higher institutions that we are so valuable to us. And then, of course, collaborations with our other partners. There are so many, but like Church Health, Christ Community, and West Clinic, and Regional One Health. They're all incredible referral sources for us and support us in so many ways. So we want to bring the community together. It's one fight, and we're all working towards the same goal. So our goal is to bring the community together as much as we can and help cancer patients and prevent cancer.
Absolutely. Talk about how we can help your efforts, because obviously, as you've alluded to, when you talk about even the transportation side, volunteerism is a big piece of the equation. Financial contributions, when you talk about, making the grants and underwriting your efforts, and the garments and all of those things, obviously take money to be able to activate. So talk about the ways we can help, including plugging into events.
Absolutely. Of course, you can donate any amount. No amount is too small, and certainly no amount is too big. We can restrict programs to your funds to a program. If transportation is what is very important to you, we can work with you on a plan for contributing to that and helping those folks who need transportation. We take, of course, just all kinds of, any kind of gift, cash, check, can go online to www.westcancerfoundation.org and give online. You can mail us a check any way you want. We would love to have the support of the community. We have such incredible support from many of our team members and folks we work with in the community and our board of directors. No nonprofit is strong without a strong board of directors, and I'm very fortunate to have one of the best.
When you look at upcoming events, obviously, in a 12-month cycle, there's many ways. I've been to many myself, but many ways to plug in and enjoy the experience, but also obviously give back. Talk about some of the upcoming events coming up near, and then a little bit, when you talk about kind of an annual calendar, what typically we need to go ahead and put on our calendars to save the date.
Absolutely. Coming up September 9th is our 11th annual West Fight On event at Shelby Farms. It's our largest fundraiser, signature fundraiser that we do. And it's a family event, and you can cycle 3 routes. You can run a 5K. You can walk a 1-mile tribute walk, or you can just come and cheer everybody on and be a part of Celebration Village and get a mimosa or grab a beer and some really great food trucks. This year, our theme is based on the Bob Marley song, One Love, because it's one love and it's one fight against cancer. And that is an exciting event. So we would love for everybody to come out and join us and sign up right now to do any of the events that you want to do and volunteer as well. The next event we have coming is the Ride to Rosemary, which has just over the last few years has grown into something incredible. This event started with 11 men 11 years ago, and they rode their bicycles from West Cancer Center to Rosemary Beach, Florida, 100 miles a day for 5 days. And this has grown from that to now they have to sort of cap it off at about 72 people that can participate simply because of the safety reasons. But that's a huge event that every year it grows and far exceeds its goal for income. And this year, I think we're probably going to hit at least $450,000. And that's just a small group of men who do most of it themselves, all the fundraising. So we greatly appreciate them.
When you look at the progress being made and, already the lives being impacted, what puts a smile on your face to know that you're working on a lot of fronts, but ultimately you're able to move the needle on a lot of fronts as well?
Jeremy, one thing that, especially to me and my team that works so hard, when we get a thank you from a patient that we have helped. Recently, we had one lady send us a note and say that our transportation program was a godsend to her. She said, I could not have made my radiation appointments if y'all had not helped me. And she said, when I come home, I feel so much better because I know tomorrow I'll also have safe and reliable transportation that's absolutely free to the patients. And that touches your heart and lets us know we are making a difference. If it's one patient at a time, we're making a difference.
When you look at working with your board and running a successful nonprofit, what's a lesson that you've learned in terms of being intentional, making sure that you're able to track all the right metrics and do the right things, but ultimately deliver impact? And so what's a lesson that you've learned, along the way that you would share as advice to others who want to make a difference?
One of my top is I don't take no for an answer. Regardless of what it's for, I'm not good at being told no. Sometimes it may be not right now, but persistence is the key, and just telling your story over and over again and the impact that we know we're making already in this community. And we can have metrics to show our donors and the community what we're doing and how we are making an impact. But it's persistence and enthusiasm and passion for what you do.
I think, sadly, all of us have been touched in some way, either through a loved one, a friend, a coworker, with the fight against cancer. What would you want the public to know, though, in terms of the need and what you're seeing in terms of, how big of an issue, how important of an issue this is for Memphis and the Mid-South?
I'll start with breast screenings. That is something that, let's face it, women dread it. We don't like to do it, but we know it's life-saving. But getting people that are less educated in the communities, that are uninsured, getting them to understand how important this is and how it can be treated if caught early. And that's the most important thing, is early detection for women. And they come get a mammogram free of charge, and it's not that bad at all. So that would be number one.
Talk about then again how we can get involved, especially for volunteerism, financial contributions, and then mention again the website and where we go to make those donations.
Sure. The third event that we have coming up this spring, a group of ladies saw what the Ride to Rosemary men were doing, and they said, well, we want to do that. And, we think we can do it better, typical females. And they have been doing it better. This will be their third year in March. And what a group of determined women. They ride 500 miles to the beach as well. And they raise a lot of money. Their first year, they raised over $60,000. And you can support that event. You can support Ride to Rosemary, any of our events we have throughout the year. We're having a golf tournament in 2024, but you can just go online and donate any amount to us, and you can trust that it will be used to help our mission and further our mission.
Absolutely. And so mention again the website. Where can we go to learn more about the West Cancer Foundation?
Sure, westcancerfoundation.org.
Leighanne Soden, thank you for all you and your amazing team do. Greatly appreciate it. Thank you for coming on the show.
Thank you, Jeremy.